This is the Nursing Healthcare Leadership Program, and it's the Masters in Nursing Healthcare Leadership. So we're looking and targeting folks who are interested in learning more about leadership and management in healthcare and in nursing. So our candidates and students usually have a couple years of experience, or they're going to gain that couple years of nursing experience while they're in our program. It's a wonderful way to transition if you're thinking about being an executive leader in healthcare to our Doctor of Nursing Practice Healthcare Leadership Executive Program. Our students as well are very diverse. We get students from all over the country, and a lot of our students have varying degrees of experience already, or maybe not much nursing or healthcare experience. And I think that's a nice mix for our cohort because it lends itself to people learning from each other. And because of the variety and the flexibility in that, you can essentially target and do whatever you want with this degree. The Institute of Medicine has kind of outlined the criteria and the qualifications that it's going to take to lead health systems in the future. So these type of programs are very, very important and have a great need in our healthcare environment. Folks who come into our program could do things like traditional nursing leadership and management, but as well as thinking about quality and safety and some of the entrepreneurial type things that are happening in healthcare. You would see from the website that our program is 36 credits and it's about 6 semesters. And what we try to do is we provide general information that a new nursing healthcare leader would need in this day and age, as well as then have a synthesis course at the end of the program. That's 4 credits or 226 hours with their preceptor. And we kind of individualize that experience based on what the person's background is and what they're looking for. So folks who are looking to be in management, in nursing leadership, could do their precepted synthesis experience with a nurse manager or a chief nursing officer, but they could also think about what their needs are and possibly do it with a healthcare administrator, or even something in quality or safety, or maybe working with someone who's developed a program that's been successful for magnet certification at their hospital. We partner with our health system, so you don't only have nursing faculty from the School of Nursing teaching in this program, but a lot of the nursing leaders and even business leaders in the healthcare system who teach some of our courses. So Duke is very unique in terms of it being a very wonderful health system with wonderful opportunities and great resources. We also have a wonderful global program where some of our nursing healthcare leadership students are able to do some of their synthesis precepted hours in a global immersion experience. So you've got the Durham Duke community, you've got global experiences, you've got the Duke health system experiences. It's just a real wonderful variety to invest in for graduate education to improve patient care. So the synthesis experience is very individualized, and because we have students from all over the country, we're looking for our students to kind of identify what they hope to do and possible preceptors, so we can work on getting those contracts and meeting them where we're meeting their goals for their education. So it's very individualized. I think a lot of our graduates do go on to do our DNP Executive Nursing Leadership Program, and I think that's a nice transition for folks who are gaining that executive nursing or healthcare leadership experience. And really there's so many opportunities that people would have, whether they choose to teach or whether they choose to go into some sort of consulting business or work with accrediting agencies, or again, quality and safety is something that all of us have on our radar these days. I think the program itself focuses on leadership qualities that are necessary in healthcare today. And I think it's a very, very important program that has an awful lot to offer for whatever nurses feel they want to be doing in healthcare and in nursing today.